Hi, Dr. Adams and Sydney again, here to talk about recovery from lung surgery. This is chapter 1 called Expectations. So a lot of times your satisfaction with how things go, both in hospital and out of hospital, has to do with what you expect. During the time before surgery, I tried to create expectations that were realistic. And we talked about hospital stay and discomfort and all that. And want to make sure we talk through that again. So number one, this isn't a pain-free procedure, and we'll talk about pain specifically. Each day is going to get a little bit better, and we'll talk about the recipes that we can use to help get under control. Sydney, a lot of times that's the most common issue that comes up after surgery, isn't it?
Definitely pain. And there are several different kinds of pain that you may experience, so we will kind of discuss those different kinds of pain later in a video and also give you our recommendations on the medications that we usually prescribe after surgery.
Okay. Secondly is energy. Everybody kind of wants to get back to doing exactly what they're doing, and we talked in the office about it. 2 weeks you'll be pretty much back to normal but sore, and then at 4 weeks I'll be a bad memory. I say that to most folks, but you got to realize, again, this is a gradual thing. You don't wake up one morning and suddenly everything's right. Gradual increase in energy and activity is what's going to make you feel better. The third is appetite and bowel movements. We talk a lot about that. Your appetite may take as long as 2 or 3 or 4 weeks to get better. And that's as much the effect, your body's response to the stress of surgery, as it is to anesthesia. So don't be surprised if what you used to like you don't like. If you don't feel like eating, you may have to force yourself a little bit. Anything else in terms of expectations?
Not that I can think of. Just got to give yourself time, because you will need to have time to heal, and it's normal to have ups and downs, good days and bad days. So
this is true, and we'll finish each of these videos with the same statement, and that is, if at any point in your recovery you have a question, you can get a hold of Sydney for sure, and me through Sydney anytime. We want you comfortable with all the ins and outs of what goes on. All right, see you in the next one.